Hi there, guys. Welcome to the Schiz and Giggles podcast. My name is Cody. I live with schizophrenia.
And my name is Kit Wallace, and I live with schizoaffective disorder.
And today we're going to be talking about oral and long acting injection antipsychotic medication. And we're probably going to throw in like some of the other forms of medication and treatment, but this is a really important conversation. And I want us always start these conversations by reminding everyone that what works for one person might not work for the next person. So medication is a individualized experience, just like schizophrenia, just like mental illness. The way we get treatment for our diagnosis will be different than the next person. So keep that in mind as we're sharing our lived experiences. Do not think that because something worked for one of us that you should automatically try it. Have these conversations with your doctor, with your psychiatrist, because it is going to matter about your own brain chemistry, your own experience, and the way that you cope with things. So please keep that in mind as we're talking about this. Kit, I want to start by asking you kind of how your journey through medication has been. What did that look like? It's really interesting for you too, because you also have to be on medication for the bipolar side of your diagnosis. So, can you give us a little intro to your own experience? And then I can talk more about my journey through medication as well. And let's just kind of see where this takes us. And I know we'll have questions come up as we do this as well.
So, one of the more complicated things about having the bipolar type of schizoaffective disorder is that, like you mentioned, I have to have treatment for the bipolar side of the condition. So, I have to take mood stabilizers in addition to antipsychotics. So, mood stabilizers treat the bipolar side. I take two mood stabilizers, and then I take an antipsychotic to treat the psychotic side of the condition and the schizophrenic side of the condition. And so, I take just one antipsychotic and two mood stabilizers. And all of those are oral. So all of those I take every single night before I go to sleep. And it's been like that for 12 years now, I believe. I started on a mood stabilizer around 12 years ago, and then I added another one a couple years later. And then a couple years after that, I added the antipsychotic. So I guess what's your experience? Because I know it's different than mine.
So I started on, antipsychotics right after my diagnosis, and I started on orals. The interesting thing for me is because I had a really good relationship with my psychiatrist, I was very involved with my journey through medication. And part of the reason for that was when I was first diagnosed, I felt like I had very little control over anything. And I'm sure you can relate. I felt like I wasn't an adult because I couldn't drive. I lost my job. I dropped out of school. I felt very much like I had to be taken care of. And being involved with my medication journey was like the first time I felt like I had control over something. So throughout the years, I tried a lot of different medication because I was trying to find the perfect combination for me. And that meant, a lot of trial and errors. When people see me now, they assume that I've been on the same medication for years and years. For me, it wasn't until about 2 years ago that I found the medication I'm on now. So I spent about 7 or 8 years doing a lot of trial and error, trying new oral medication. At one point, I was on 5 different daily medications. And I don't have a mood disorder. So those were all different, like dosage and types of antipsychotics. And honestly, like they were working fairly well. I don't want people to hear that, daily oral medication wasn't working well. I had some stability. I was having less symptoms. Like I was seeing results from that medication. But I had kind of a severe episode about 2 years ago, and I posted about it on social media. I felt really embarrassed about it because I had to go into a psychiatric unit while I was like getting really big on social media. I was becoming a really big advocate. And that was really frustrating because I felt like I had let everyone down. I felt like I had let myself down. And I finally decided to try long acting injections. And I know we're going to talk more about those. But for anyone who doesn't know, a long acting injection is a injection that you take for an antipsychotic that can be 1 month, 3 month, or I think some of them now are up to 6 months. And
Ooh, wow.
so, yeah. And so for me, I travel a lot. I forget my medication. I forget medication when I travel. There's a lot of human error that made me very nervous about staying on oral medication. And I already had a lot of issues remembering to take my meds or being compliant with meds. So that's why I eventually switched to an LAI. For me, I've had less side effects, less symptoms with an LAI, but once again, this is an individualized experience. This is just my own lived experience. And one of the big things for me, like in my oral medication phase, was it really bothered me how frequently I had to like consciously think about medication and schizophrenia because I was taking medication 3 times a day. So morning, afternoon, evening. And that is so like it my life revolved around this medication schedule and it was a constant reminder of my diagnosis. So that's part of the reason I eventually switched. LAIs let me kind of separate myself from my diagnosis from like the regimen of medication. When you were talking about yours, you said you were you only taking medication at night then before you went to sleep, or did you take medication multiple times a day?
It started as just a once a day before I go to sleep thing. Like my first mood stabilizer was just a at night thing, and it stayed like that for several years before I added the second one. But even the second one was still a once a day at night. So the idea that my psychiatrist had was to take most of my medications at night so that I could sleep off the side effects. So that was kind of the vibe of it. Even though I could probably take them in the morning and it would have been okay, but I don't like the side effects, so I was, like, happy to sleep them off, and so, since then, whenever a medication or a supplement has been added to my regimen, I do take it at night before I go to sleep. That's just the normal thing for me, and I do have anxiety medication that I take multiple times a day, and I have other medications I have to take for other chronic illnesses, but the vast majority of my psych meds, I've always taken them at night.
That I will also say that too, like, this comes back to the individualized experience with medication
Mhm.
because part of the reason that I took meds multiple times a day was because that's what worked best for me. So, when I went into, work with my psychiatrist on my medication regimen, one of the things I explained to her was, "I want to be more functional during the day." Even if that means that I have more symptoms. I wanted to be more coherent because some antipsychotics, especially heavier ones, they can make you very dulled, almost like zombie-like, and I did not like that. I wasn't willing to, trade that stability for, not having any symptoms. So, I probably could have been on higher dosages during the day and had less symptoms during the day, but I was willing to trade that, and so that was a conversation I had to have with my psychiatrist where she was very honest with me. She said, "Hey, we can do higher dosages at night so you can get good rest, you can sleep better. And then during the day, we can have you on lower dosages so that you still have symptom relief. But the downside of that is you may have symptoms more frequently." And so that was a trade off I had to make when I was looking at my own medication regimen. And so that's why I always like talk about the importance of the individual experience because a lot of people, depending on the severity of their symptoms, need high dosage all of the time. Day, morning, afternoon, evening, like it doesn't matter. I did pretty well with the medication regimen I had set up. And so for me, that's what worked. But I don't want anyone to think, oh, that'll work for me. Like you need to talk to your psychiatrist first. And one of the things I think we have to talk about, whether it's LAIs, whether it's oral medication, the one thing that keeps a lot of people off medication or gets them to quit medication is side effects because I could sit here all day and tell you how much medication has helped me. Uh, but then there are side effects. And I think it's irresponsible not to talk about the possibility of things you can experience that even though you are getting treatment that's limiting your symptoms and getting rid of some of your psychotic symptoms, there is a very real expectation that you'll probably have some side effects. So, can you talk about some of the side effects you experienced? Which ones were like detrimental to you? Because sometimes I think there's trade offs. Like, there was some side effects that I was like willing to deal with, and then there was some that I absolutely wasn't willing to deal with. So, did you have that same experience? And like, did that cause a lot of like trial and error in your medication, like finding what worked for you?
So I definitely want to say that the first mood stabilizer I went on worked. The
Yeah.
second mood stabilizer I went on also worked. And the first antipsychotic I went on worked. So I did not have a insane trial and error process where I was trying a bunch of different stuff. It was just like everything that I was given worked for me. There was a time where I tried to switch antipsychotics because I thought one of the side effects was worse than it was basically, and that did not go well, and that had an antipsychotic that I could not tolerate. But I would say of all the psychiatric medications I take, the worst side effect I deal with is a result of my antipsychotic, and it's something called dystonia. Dystonia is a part of movement disorder style side effects that are caused by antipsychotics because antipsychotics, one thing they do is they mess with dopamine in the brain. That's like their whole thing is they're dopamine blockers. And the problem is that dopamine is also a key neurotransmitter involved in movement, which a lot of people don't necessarily know. They think, oh, it's just a feel good chemical. And so when you mess with dopamine, you mess with movement. And a lot of people who take typically first generation antipsychotics, they're older. Those have a higher risk of these kind of symptoms. And the newer antipsychotics, which is what I take one of the newer ones, it doesn't cause as many of those symptoms. But for me, I'm unlucky. I do get dystonia as a part of it, which is comes across as repetitive muscle jerks, usually of my right arm. When I cross my arm, that triggers it. And it just moves around in a very repetitive way. It's not painful, but it is disruptive because I can't cross my arms in lab meeting or cross my arms with my friends because my arm will just start like jerking uncontrollably in that moment. And so that's kind of difficult for me. When my antipsychotic is adjusted, sometimes that gets worse. So I'll get full body jerks that happen in the middle of the night when I'm trying to sleep. It's kind of like restless leg syndrome, but for your entire body. And it was only solved by taking a hot shower, for example. And so that was really hard to deal with, but I still put up with it because I liked what the medication did for me otherwise. And I'd say the other weird side effect I get it's not like intolerable, but it's one that does bug me quite a lot is that one of the mood stabilizers I'm on causes word finding issues at higher doses. So I have a harder time pulling words out of the Rolodex of my brain. So I'll sometimes pull the wrong word and just say, which will probably happen on this podcast. I will be talking and I'll say the wrong word. It'll be totally out of character and we'll have to keep it in. But that's something that I deal with. And so it's mainly the dystonia and the other stuff. A lot of people who take antipsychotics, they get daytime sleepiness and tiredness, and I don't get any of that. So,
I can probably talk more on the side effects then because like I said, I did a lot of trial and error and I faced a lot of different side effects from medication early on before I found the medication I'm on now. So you said dystonia, is that correct?
yes, dystonia.
So one of the side effects I dealt with was tardive dyskinesia,
Oh,
which is like also movement based. So do you know what is the difference between those two? Because what you explained sounds like tardive dyskinesia, and that's what I dealt with. Is there a difference between the two?
so tardive dyskinesia is sometimes permanent. It can be temporary if you
Yep.
reduce the medication, which yes, it sounds like you understand what that's like and whatnot. I'm actually interested to hear your experience. But anyways, tardive dyskinesia is more like it affects the face, the jaw, the tongue. It's really from here on up, shoulders up is really where tardive dyskinesia happens, and it's a term for a permanent movement disorder. Like I said, sometimes it can be reduced and go away, but a lot of people it sticks around. You have to take medication to treat it. Dystonia is a kind of extrapyramidal symptom that is not related to tardive dyskinesia, but it still has similar symptoms what you'd think of. I'm trying to figure out how best to explain this, but it's kind of wild to me that the two are both movement stuff, but they're both treated very differently. And the big difference for me, and the reason I know what I go through is not tardive dyskinesia, is that the medication I use to treat the dystonia is an anticholinergic medication, so it messes with acetylcholine. That medication gets rid of my dystonia for the most part. If I had tardive dyskinesia, it would make it worse.
Gotcha.
And
Okay.
so medications that are used to treat tardive dyskinesia actually make the dystonia I experience worse. So they're
Yep.
kind of like a two different, uh, similar in symptoms, but different in how they're treated and different in how they present in people. So hopefully, does that make sense?
Yeah, absolutely. So one of the first medications I was on was a first generation, and it was actually working fairly well for me. But as time went on, I started getting facial tics. So like essentially, I was getting on the right side of my face, my lip, my eye would
Mm.
have like severe twitching, and it was basically movements I couldn't control in the face and the mouth. And that was something I started experiencing. And as soon as we noticed it, because I had a very good relationship with my psychiatrist, I brought it up right away. We transitioned off of that medication. And after a while, those symptoms did go away. So I have a really strange thing where now I still do get facial tics, but it's only when I'm having active symptoms. It's very strange. My psychiatrist couldn't explain it, but it's like it's almost like that part of the tardive dyskinesia stuck around. Like, I don't know if it's just my brain processing, like that's how I deal with symptoms, or that's what I was doing when I used to have symptoms. But to this day, even though I don't have TD in my like regular everyday life, I will still get facial tics during auditory and visual hallucinations, which I have yet to have anyone explain to me why that is, and I find it really interesting because I've looked it up and I can't find like anyone else who's really struggled with that. And it's not a huge deal. It's actually come in kind of handy because if I start having facial movement or facial tics, people around me are able to identify that I'm having symptoms well before I'm able to. So that's how like my wife, my coworkers, people like that were able to start recognizing that I was having symptoms was from these essentially like facial movements that I was having. And that was all kind of that all started after I had this side effect of tardive dyskinesia. Thankfully, the long term, I was able to reduce my medication and eliminate most of those symptoms. There's also the big side effect that I know scares people away from antipsychotics. It's the one that I hear the most about. Do you know which one I'm talking about?
I think I do. I think I do, yeah.
Weight gain. And like,
Yep.
hear me out. So here's how I've looked at this, cuz I once again, I want to be honest. I want people listening to this to know that like we're not trying to sugarcoat things. We're not trying to make medication sound like a cure all or this insanely symptom free, side effect free thing. I did experience weight gain with early antipsychotics. And so for me, I was always a very skinny kid. I did need to put on some weight, but I definitely put on much more than I needed to. So I think it's important to recognize there's a lot goes into this because one, yes, my medication did lead to an increase in weight gain, but it was also a lot of lifestyle things. Like I couldn't exercise properly when I was in active psychosis. I didn't eat well when I was in active psychosis. So I'm just now kind of trying to live a more physically healthy life to offset some of that weight gain. But I know that's one that scares people off a lot from antipsychotics or makes people quit their antipsychotics. I want to make sure that people know like if that's a symptom that's happening that you're really worried about, talk to your doctor or psychiatrist. There might be an antipsychotic that works better for you that doesn't have that side effect. So I want to bring that up. I don't know if that's one you hear a lot about, but I always get comments about that. I hear a lot of advocates who quit medication at one point because of weight gain. And I think it's a really important topic because no one wants to have those side effects. No one wants to have to go through weight gain or these other things. But for me, what the medication gave me, clarity, less symptoms, that was more important to me than the weight gain. And so I was able to work through that. And now I'm losing a lot of weight. I'm living a healthier life. But it definitely played a big role in like my body dysmorphia and my self confidence early on.
So my experience is like I seem to see on the other episodes, it's the opposite. It is actually the opposite. So I get a lot of comments asking me how I stay so thin on antipsychotics, trim on antipsychotics, and the truth is that antipsychotics for me, they take away my appetite. They make me hungry in the middle of the night. That's a thing. But the vast majority of my day, I go through it not experiencing hunger. I don't get hungry until like 1, 2, 3 p.m. And that's just a normal thing for me. When I tried to go on a different antipsychotic, which I mentioned earlier in this episode, I ended up losing my hunger almost entirely and I dropped 20% of my body weight. And it was actually a very serious situation that resulted in a bunch of other medical appointments and testing and whatnot. Like, there's a lot of bad stuff that happens to you when you're underweight. And I learned that the hard way. And then I went back on the other antipsychotic, which gave me a little bit more of my hunger back. So I was able to gain that weight back. And I'm doing pretty well now. But it's very frustrating to me to have people ask me how I stay so thin and trim when in reality I struggle to eat because of my antipsychotic. And that's a side effect that a lot of people don't really talk about because again, people are so they hear about the weight gain, they think of the weight gain, and it's like the other side of the coin is true too, and I can't say that enough, and it's frustrating for me because I also can't give any level of advice on how to deal with weight gain from antipsychotics because I just don't struggle with it. But I know it's super common, and I'm glad you brought it up.
It's one of those side effects that it's a make or break for a lot of people. Like they will not start antipsychotics because of the idea of weight gain. And I think That's so dangerous, and I think it leads to a lot of people not getting the care they need. So I just want to say, if you're on a medication that you think is leading to weight gain, that is a side effect that you should bring up to your doctor
Mhm.
or psychiatrist. And I won't say all of them, but most of them will be willing to work with you on that. So when I started to experience like a lot of weight gain, like to the point where it was very noticeable, I brought it up to my psychiatrist. That was part of the reason we had some trial and error. I really struggled with that. I already have body dysmorphia issues, so I brought it up. We tried a new medication, and although I still experienced a little bit, it definitely helped, and it was the medication I tried after that was a lot less issue with weight gain. And so that's just I wanted to talk about side effects because during conversations about medication, I think sometimes advocates, and I'm guilty of this. I think sometimes I talk about how good antipsychotics have been for me and how much they've helped me and how much they've created a life of stability that I never imagined. But I think it's irresponsible not to set the precedent that, like, yeah, there can be side effects, but you can talk to your clinical care team about those side effects and make sure that if something is going on that you are not willing to live with, tell your psychiatrist, tell your doctor, don't just quit your meds. Because, in my own experience, I'm like, I would much rather have to try a new medication than have to deal with the side effects or symptoms that come with not taking my antipsychotics.
Yeah, side effects are a thing that they're different for different people, and they're going to be different from one person to another. And in my experience, talking to my doctor about the side effects I experience, whether it's the word finding issues or the dystonia, he's like, hey, there's a medication for that. I'll give you this. Hey, we can maybe lower the dose to reduce the word finding problems if you're down for it. So there's like different adjustments that can be made. And in my own experience, I've seen my providers be very, very helpful for that. So yeah, good point.
So, kind of going back to the conversation more broadly about oral medication and long-acting injections, I've had good experiences on several oral medications. So, when I talk about my transition to an LAI, there was a lot of factors involved with that. For me, convenience was a big thing. I travel a lot. I struggle to remember to take medication. Memory is an issue I have a lot with my diagnosis. And so oral medication was hard for me because even if I had that routine and I had a regimen of medication, sometimes I would forget. And it doesn't take much of forgetting your medication to have symptoms, to have, a bad episode. So for me, long acting injections were just a better fit. I do know a lot of advocates who are still on oral medication that has worked well for them throughout their entire experience. So I'm not here to convince anyone
Hmm.
that LAI will be the right choice for them. The thing that struck me when I started it was I didn't know it was an option. And I do want people to know that it's out there because I think if someone has insurance and someone has the resources, it can be a really good option for people who might be less med compliant. I quit medication several times when I was on oral medication for several reasons, and I could talk more about those later. But I think it really is important to find what works best for you and know the options out there. So I didn't know about long acting injections until several years into my medication journey. And when I first found out about them, I was hesitant because despite all my tattoos, you might find it funny to know that I'm terrified of needles, actually. Uh,
Oh,
yeah,
really?
I am horrified of needles. And
What?
yeah, and so everyone is always shocked when I go to get shots and the nurses see that I have all these tattoos. And I like turn into a baby about shots. My wife has to sit there with me. And I literally had a nurse look at me and go, "You have a throat tattoo and you're afraid of a shot in your arm?" I'm like,
Oh
"Yes,
my
I'm
gosh.
terrified."
Oh my gosh, this lore, this
Yeah.
lore.
Yeah, and I it's something that, like, it was one of the things that, turned me off about LAIs at first. Also, fear of hospitals is a very real thing. I didn't wanna have to go into a hospital every single month to get a shot, because if you're someone who's been voluntarily or involuntarily committed, you probably have some trauma around hospitals and ER rooms and stuff like that. Just the smell of a hospital, I get so anxious. I get so worked up. I have increased symptoms. I get very stressed. So that was a big reason that I didn't want to do it. I also didn't know that I could like get an LAI at like a Walgreens because they are allowed to administer like shots and vaccines and stuff. So that was part of the reason I got more comfortable with the idea. I still to this day am afraid of needles and shots, but it was more practical for me, for someone who travels a lot, for someone who has difficulties with memory, for someone who has quit medication several times. I would love to hear, because you are on oral medication, what do you do to remember medication? And like, is it just has it just been ingrained in your daily schedule, or do you have to do something to remind yourself? Like, what is it that you do that has allowed you to be successful on daily medication?
I think the biggest reason I've been successful on taking my meds for as long as I have is because I've been so excited about the fact that they work.
Yeah.
I'm really glad that they help my symptoms, they help the condition, and I know that when I take them, that means I get one more day of being sane. And so I get to be sane for one more day. And I just take my meds at night knowing it's going to help me tomorrow. And I started 12 years ago doing this. Like I was in high school and it just kind of became a habit where I just was like, okay, all right, it's nighttime. Got to take my meds. Got to take my meds. And I have probably like the mood stabilizer that I've been on the longest for 12 years. I've probably missed it maybe like 5 times and none of them were on purpose. None of them were on purpose at all. And withdrawal on that one is really not fun either. So going off of it would just be a horrible idea. And it never really crossed my mind to go off my meds for any reason because I know how much they help me. And so taking them at night was easy to do because I knew they helped. And so I just kind of like go through my day and like, all right, nighttime, gotta take my pills. Okay, nighttime, it's time to go to sleep, gotta take my pills. I just have it worked into my routine. And even when I travel, whether it's domestic or international, like I still know I gotta take my meds. Like there's this part in my brain that just has a little bit of a daily reminder to do it, and I don't end up forgetting my meds.
I will say that I also did kind of get to that point for me. If anyone's looking for tips, I can't say enough about pill organizers because
Yes, yes.
if I had it in a bottle and I forgot if I took it or not, I would go and be like, okay, like, how do I know if I like took it already or not? So having like pill organizers, I know it makes people feel like an old person to have like a pill organizer. Like that's how I felt. I was like, I feel like an old man having to have an AM and PM pill organized, but it did help me a lot.
Have you ever counted all the pills in a pill bottle to see if you took one of them?
Oh yeah.
Yeah.
So when I was still like resistant to getting a pill organizer, that's what I used to do. But it's like, especially if you struggle with memory, then I would have to like look at the calendar, make sure I'm doing my math right, like double, triple check everything. And then sometimes I'd still get it wrong. So for me, I think there was just a lot of stress about having to remember medication because I
Hmm.
do have bad memory. And like that made me so anxious all the time. And like that's what I really struggled with. And that was like one of the decisions that led me to my LAI. Did I ever tell you about the 2 times I quit medication when I was on oral medication?
No, but you should totally tell the audience.
Okay, so, there was 2 separate times that I quit my oral medication, and there are 2 reasons that I hear a lot from peers and other advocates. So, the very first time I quit my medication was shortly after I was in the first year or 2 of treatment, and I really expected antipsychotic medication to be a cure-all. So, I went into it with this unrealistic expectation that it was gonna make me just a completely normal person again. Because I was very anti-medication when I started. I was very anti anything put into my body, and so I really was like distrusting of medication. So when I finally took it, I was like, "Yay, this is gonna fix everything." And then when it didn't, I was still having breakthrough symptoms, even though I was having a lot less symptoms. My delusions were gone, my paranoia was gone. I was still having some auditory and visual hallucinations because I got symptom relief from my very first antipsychotic. But since it didn't all go away, I kind of went into it with unrealistic expectations, and that made me so disappointed that I quit because I was like, well, if it's not going to fix me, then why take it? And thankfully, quitting showed me how bad I was without it. So I'm very lucky. I had friends and family who got me back on medication before I went through too bad of a relapse. But I did quit, and immediately, like, within a few days, I started seeing, like, all of these symptoms come back, and I went through a really bad episode, and so that reminded me, like, "Oh, yeah, there's a reason I take this medication." The second time I quit, and this is also so common, I hear this from people all of the time. I was on medication probably 5 or 6 years into my journey, just a few years before I started my long-acting injection, and my medication was working so well. I went like a whole month without any symptoms, and my medication was working so well that in my brain I was like, "Well, maybe I don't need
Oh, yep.
medication anymore." I feel so bad anytime I hear this because I hear patients say, I don't know if you've heard that, you
I have,
definitely
yes.
shook your head,
Yeah, I
but
definitely have heard it. I definitely heard it for sure.
and like that it sounds like you've been pretty med compliant, but have you experienced that? It sounds like maybe you've just heard it more from other people.
I always tell people, if you're happy and you know it, it's your meds. So I have never, like, when I'm doing really great, I know it's because of the meds. So I keep taking the meds because, again, I get to be sane for one more day when I take
Yeah.
them.
I think with me, what kind of happened was not only were the meds working really, really well, I think I was having some breakthrough symptoms, and I think the delusion got the best of me, and I thought, you know what, I'm very well now, and I was doing great at that point. I was med compliant, I was back working, I was doing all these things, so I quit. Once again, led to a very unfortunate episode for me. I was able to get back on meds before it got too bad, but those are the 2 times I quit medication, and I always wanna tell those stories because I want people to know, like, I think people see me as, like, an advocate who has it all together and knows what he's doing and does everything correct, and that is not the case. I've made the same mistakes as a lot of other peers and advocates, and I want people to know that because those moments could have ended very badly for me. I could have wound up back on drugs. I could have wound up back in jail. I could have wound up homeless, like many people with this diagnosis. So I want this episode to be a reminder for you guys that please take your meds. If you're in a position where you do want to like explore other options, talk to your psychiatrist, talk
Hmm.
to your doctor. Do not do anything without guidance. Do not do anything without trying to taper off. Do not do anything without understanding how your medication affects you.
I think it's also really important to mention that what you talked about earlier, saying that you still had symptoms even while on medication,
Yeah.
it's important to say that that's a pretty common experience of people with schizophrenia spectrum disorders, is that they go on antipsychotics and they still have breakthrough symptoms. They still see things, they still hear things. It's just important to note here that it's not as frequent. It's more manageable with medication. Me personally, I still hear voices. I just don't hear them 24/7. And so
Yeah.
they're more manageable now. I know how to keep them away for the most part with coping tools. And yeah, it's important to say that just because you go on medication doesn't mean the symptoms are gonna go away entirely.
I get this a lot because I still post videos when I have symptoms and me using my coping mechanisms. And I inevitably always get comments asking, well, why even be on medication if you're still going to have symptoms? And so, once again, I want to reiterate what Kit just said. I used to have symptoms all of the time. If I was awake, I was having hallucinations and paranoid thoughts. Now that I'm on medication, I experience breakthrough symptoms a few times a month, which is like unbelievable. So it is hard to realize like maybe you won't get complete symptom relief, but you will get relief. You will get less symptoms. You will get help. And a lot of it is going to be talking to your psychiatrist. Be willing to try new medications and new treatments. Be willing to do things outside of medication too. Worry about your mental wellness, worry about your physical health, worry about things like that, because all of that plays a role in your state of being, in how you react to medication and how you get through your recovery. So, I know we could go on a lot longer here, and I'm sure we'll do more episodes about medication and treatment. But I want to make sure that we keep these episodes, a reasonable amount of time because I know a lot of our neurodivergent listeners appreciate that. So, Kit, do you have any final things you want to say about medication, treatment, anything like that for the audience?
It's that it's worth it. It's worth trying to do. It's worth working towards. It's something that is worth doing. And I think that's a really important thing to say because medication has radically changed my life. It's made me a much more functional person. Cody, you've talked about how it's helped you, and it's helped countless others in our situation. And I think it's important to say that medication is it's a good thing. It's a good thing for people to do and go after and try to get.
And with that, just like I said at the beginning of the episode, remember that your experience is going to be different. So keep that in mind when you're listening to this and you're kind of taking in what we said about our different types of medication and what's worked well for us and what hasn't. Uh, Even with side effects, it's going to be different for you. So I always want to reiterate that anytime we talk about treatment or medication. Thank you guys so much for joining us for this episode. And Kit, any final words for the people?
Yes, if you like the podcast, rate it. Give us a little comment. Reach out to us on Instagram. We are Skits and Giggles. That's skits like schizophrenia and giggles. And also, we have an email, which is skitsandgiggles@gmail.com. If you have any video ideas, guest ideas, send it all in. We would love to hear your thoughts. And other than that, I guess I should say what I always say, and that is that the brain is a minefield and we brought flip flops.
Thank you guys so much.